Today, we're examining three surgical procedures commonly used in managing chronic tonsillar conditions: extracapsular tonsillectomy, intracapsular tonsillectomy, and tonsillotomy. Each of these procedures has distinct purposes, techniques, and indications, which can impact the choice of treatment based on the patient's needs and underlying conditions. Extracapsular tonsillectomy involves the complete removal of the tonsils, including the tonsillar capsule. This procedure is typically indicated in cases of recurrent tonsillitis, where a patient experiences at least 7 episodes in a single year or multiple episodes across 2 to 3 years. Extracapsular tonsillectomy is also considered for patients with obstructive sleep apnea, a peritonsillar abscess, or when there is a suspicion of tonsillar malignancy. However, there are notable contraindications. This procedure is generally avoided in patients with bleeding disorders, as complete removal increases the risk of significant hemorrhage. It's also contraindicated in patients with severe cardiovascular or respiratory conditions, or in cases of acute tonsillar infection if inflammation is severe. In contrast, intracapsular tonsillectomy involves partial removal of tonsillar tissue, preserving the tonsillar capsule. This technique is often chosen for younger patients with obstructive sleep apnea or recurrent tonsillitis, as the retained capsule helps reduce the risk of postoperative bleeding and provides a lower pain profile post-surgery. This approach can also result in quicker recovery, making it favorable in pediatric cases. Contraindications include situations where tonsillar malignancy is suspected or if infections are severe and cannot be managed with partial removal alone. Additionally, patients at a high risk for residual tonsillitis may not benefit from this procedure, as the remaining tissue could lead to recurrence of infection. Lastly, tonsillotomy is a partial removal or reduction in the size of the tonsils, primarily aimed at relieving airway obstruction while preserving some tonsillar tissue. This conservative approach is often preferred for children with mild to moderate obstructive symptoms, such as disordered breathing during sleep, especially when a less invasive option is desired. However, tonsillotomy is generally not indicated in cases of frequent recurrent infections, where complete removal is more effective. It's also contraindicated if there is any suspicion of tonsillar malignancy, as partial removal may leave behind malignant tissue.